Hi, my name is Rachel Baisden, a student at the University of Nevada, Las Vegas, currently enrolled in the Introduction to Public Health. Today I will be discussing death by suicide among Black Americans. The right to bear arms and gun control are current topics of debate among lawmakers and citizens. Current mass shootings have brought gun violence to the forefront yet again. Based on the CDC findings and a 2019 study, approximately 109 people died as a result of firearm-related incidents. Among those deaths, 86% of those were males. Black males had the highest percentage of firearm-related homicides. However, did you know that 6 out of 10 firearm-related deaths were actually suicides? That is 60%. Typically, firearm suicide is greatest in the Native American, Alaskan, and non-Hispanic white communities. The average age is usually older, around 75 years of age plus. However, suicide rates among Black Americans is increasing, and sadly, the average age is around 20 years old. Death by suicide has been a public health concern for quite some time. However, during the COVID-19 pandemic, the concerns were heightened. Isolation, job loss, lack of support were all factors that had public health officials even more concerned that the suicide rate would be increasing. Dr. Paul Nestet decided to co-author a study in the state of Maryland alone to determine if any of those concerns held merit. After his study was complete, surprisingly, he found that the number of suicides among white Americans decreased. Astonishing, however, he discovered that deaths by suicide in the Black community actually increased. Dr. Nestet recently shared his findings during an interview on National Public Radio. That interview may be heard on the following slide.
We're going to move to another topic now, one that also touches on guns. The statistics show that a majority of gun deaths in America are actually suicides. And for the past year, many experts and lay people alike have worried that the mental health stresses of the pandemic, isolation, job loss, lockdowns, the constant reminders about sickness and death, could lead to an increase in suicides. And while scientists are still combing through the data, the early findings suggest that might not have been the case, except for one group, African Americans. According to one alarming recent study, focusing on just one state during the first weeks of the lockdown, but alarming nonetheless, suicide mortality among African Americans nearly doubled, while decreasing substantially among white residents. We wanted to learn more about this study, which focused on Maryland, so we called one of the co-authors. Dr. Paul Nestet is assistant professor of psychiatry at Johns Hopkins University in Baltimore and a researcher who studies suicide. And before we continue, let me note that we know that this is a topic that may be upsetting to some. So if that's the case, we invite you to step away for a few minutes and we'll be happy to welcome you back later on. Having said that, Dr. Nestet, thank you so much for joining us.
Well, thank you for having me.
So let's get all the sort of the disclaimers and the metrics and the caveats out there. Again, the study focused just on data from Maryland, and you compare data from 3 distinct periods pre-COVID, while closures were happening, and then while reopening was happening, and you compared this information to the same periods in previous years. Do I have that right?
That's absolutely right.
So let me just read from the paper. Among Black residents, suicide mortality appeared to double during period 2 compared with the means in 2017 to 2019. In contrast, suicide mortality appeared nearly halved among white residents during period 2 and 3 compared with the means of 2017 to 2019. And you point out that the population didn't change substantially between 2017 to 2019. So that's a significant change.
Yeah, it's very significant. It actually was surprising in a couple of different ways. For one, as you mentioned, many experts thought that suicides in general were going to go up a lot during the pandemic because of all of those stressors that you listed at the beginning of the show. We didn't see that happen in aggregate. But when we disaggregated the data, as you said, during that, I guess we can call it now the first wave of COVID in Maryland and the United States in general, there was this incredible doubling of the suicide numbers in African Americans here.
What made you want to look at this? As you point out in the piece, that to your knowledge, this is the first to characterize suicide trends by race and ethnicity during COVID-19. What made you take a look at this?
Well, part of it is knowing that even if there is an aggregate decrease in suicide during COVID, as we were starting to see in Maryland, there are vulnerable populations that were hit more by COVID than others. We know that Black Marylanders had higher rates of COVID infection. This is the case nationwide as well. And also, once infected, higher case fatality rates. So basically, this pandemic hit Black Marylanders a lot harder than white Marylanders. So there was reason to believe that there might be more distress, and suicide has traditionally been a marker of distress in our data.
But why do you think that is, though, given that I think your study indicates that suicide is more common generally among the white population? Is that accurate?
That's true. That's true. About nationwide, a majority of suicides are white. White Americans have a higher rate of suicide than Black Americans in general.
And in Maryland as well.
In Maryland as well.
So this is a significant change. Do you have a theory about why that is?
Yeah, well, we can make a lot of assumptions. I have some theories. I think part of it, as I mentioned, Black Marylanders were hit harder by the pandemic. They might have had less of an economic cushion to withstand things like job loss or less ability to draw on resources for things like childcare. And there's no way to know for sure with these particular suicides if the pandemic played a role, but the correlation to the increase in infections and deaths and the suicide rate is hard to ignore. It might also be an issue of access to care. We know that Black Americans in general, and Black Marylanders are no exception, have more difficulty accessing care, have a higher likelihood of not having insurance, and that applies to mental health care as well. So having the ability to reach out and get help when you need help is really important, and that's something that we can prioritize and make sure there are resources available for everyone that needs psychiatric help when needed.
I am going to make an assertion here, which you may or may not agree with, but I'm going to make an assertion here that I think we don't often see African Americans as people who are vulnerable to suicide. And I wonder if you feel that this study amplifies our understanding of this as a significant concern.
I absolutely think that you're correct. Because the majority of suicides have been among white Americans, there's been too little focus on suicides among people of color. We have had a relatively good history of looking at suicide in Native American, American Indian populations, because there's high rates there as well. But specifically Black Americans, the rates have been going up faster than they have in white Americans. But we're recognizing more and more that risk for suicide is up there and increasing for Black Americans, especially younger Black males. In the white population, we see suicides more in middle age and sort of very old, like after 85. But the risk period is highest for Black Americans around age 20. And that's arguably much more tragic to lose someone so young.
Dr. Paul Nestat is assistant professor of psychiatry at Johns Hopkins University. He's one of the co-authors of a recent study on suicide mortality in Maryland during the early weeks of the coronavirus pandemic. The study is published in the April 2021 issue of JAMA Psychiatry. Dr. Nestat, thanks so much for talking to us today.
Absolutely. Thanks for having me.
Dr. Nestat just shared some interesting data with us. Prior to the pandemic, the number of suicide-related deaths in the Black community was already on the rise, especially among the male population of Blacks under the age of 35. Suicide is the third leading cause of death for young Black males. Mental health disorders like depression and substance abuse are contributing factors, just like amongst other ethnicities. However, the stigma attached to mental illness and seeking support prevents young Black men from receiving preventive care. Suicide prevention is key in the public health sector. The CDC, or the Center for Disease Control and Prevention, have laid out a few strategies in order to prevent suicides from occurring. I'd like to highlight a few. Remember, develop problem-solving and coping skills. Identify and support people who are at risk. Also, create a safe and protective environment. Remember, anytime you feel at need, seek support. Mental health wellness is important for all. It doesn't matter your race, your gender, ethnicity, religion, socioeconomic status. If you are not feeling well, if you feel isolated, invisible, alone, misunderstood, reach out, speak to someone. There are people out there that are available to you who share your concern and just care and love you. Even if it's not your family who's there to support you, you can make a new family, have an extended family. Just let someone know that you are in need. On your slide, there are some local numbers. If you're a Nevada local, on your phone, you can just reach out and dial 211. You can enter your zip code by text. When you text 898-211 and enter your zip code, you can reach out for help. Locally, those are your options. Also, you see there's some national options as well, like the Suicide Prevention Lifeline, or you can text HELLO to 741741. 911 is always a source as well. If you happen to be on social media and you see a post that just doesn't sit well in your gut, trust your gut. Reach out to the media outlet. Allow them to reach out to the individual and do a well check and see a welfare check and see if everything is okay. It's okay not to be okay. Remember, as a student at UNLV, mental health and wellness services are readily available to you. Student Counseling and Psychological Services, also known as CAPS, provides a variety of services to help every student address mental health concerns in order to make the most out of their college experience. You may visit them on campus, reach out to them via email at www.caps@unlv.edu, or give them a call at 702-895-3627. Continue to stay healthy, stay well, good luck in your studies, and remember, rebels make it happen. This concludes my presentation on the Black community and suicide. Thank you.